All right, we are now recording. So I want to welcome everybody to our first GAIN office hours. We're going to see how this goes. Instead of doing a second training today, we turned this into a GAIN office hours to see if we could tackle any questions, concerns, see how things were going, and see how everybody's doing. So I'm going to go ahead and open up the floor. So we will basically, this is up to you. What do you need from this call? If you don't have a camera, that's okay, Michael. We'll open up this call, whatever you need. What questions do you have? What concerns do you have? If you could do me a favor, please, and we could raise hands. That way we can go ahead and go off of whoever's raising hands first, and we can kind of go from there. So, Callie, starting us off. Open the floor for you, and what you got? What's up?
Hi, just two questions. I took the training 2 weeks ago, maybe 3. And they said they were going to email out passwords as well as the link, and we've not gotten either one of those. That's all I need is just the link and the passwords.
Okay, so that would be Scott. Scott Olson with Chestnut has said that they will need to send out the passwords and the link. Can you please, Callie, shoot me an email? I'm going to put my email address in here. It's really long, so bear with me. So that's my email address in the chat. Please shoot me an email with who you're needing passwords for, who you're needing links for, and that way I can go ahead and shoot that to Scott, and then he can hopefully get us that information. What we might be waiting for is the agreement on his end. If your county has sent in the agreement, but they have not signed it yet on Chestnut's end, we may be waiting on that. And they were inundated last week, especially with trying to get lots and lots of logins. So it might have gotten lost in the shuffle. It might have been just kind of pushed to the back. But yeah, shoot me an email and we'll go ahead and get that over to Scott and see if we can get those logins.
So if I'm not doing the GAIN right now in Civic Court, is that okay? And I mean, until I get my,
Yeah, we've kind of got to do what we can. We do have a form that we could send you as well. And you could do the GAIN on the form and then add it later once you get the logins. We do have some folks doing that.
Okay.
And if that's something you would like, please go ahead and pop that in that same email.
Okay.
And I'll go ahead and add Camille then also to that email because she's got that paper copy. And we can see if we can then get you that paper copy as well. All right. Awesome. Thanks, Callie. All right, let's see who I've got next. I've got Olivia would be next. Olivia.
I was just hoping that I could also get a paper copy of the GAIN.
Yes. Can you also please shoot me an email and let me know that you're needing a paper copy and we'll get you a paper copy.
Thank you.
Absolutely. Thank you. Sorry about the dings. Everybody continues to join. So that's why the dings on my end. Pueblo JBBS, that's who I've got next with their hand raised. What do we got?
We have a question for completing the GAINS assessment for competency clients.
So JBBS would be only JBBS. So if folks are participating in only competency, if folks are participating in bridges, not specifically JBBS, you would not do the GAIN.
But the people that are in competency are JBBS.
So technically, no. So JBBS is separate funding. JBBS is competency. Competency is separate funding. Technically, JBBS manages the competency enhancement funds, but they are not JBBS funds. They are actually through the OCFMH, which for the life of me, I can never actually remember what that acronym stands for. But they are through still OBH. So competency enhancement folks are technically separate from JBBS folks.
So it's okay to put no, not completed for those people.
That is okay. Yep. Well, you good with that?
I'm sorry, I had to jump off really fast. So just to recap, competency enhancement folks, even if they're getting JBBS funding, do not have to complete the GAIN?
No, if they are getting JBBS funding, if it's separate. If they're getting SUD, mental health, pre-sentence. So for this year, we don't actually have pre-sentence. It's just under SUD and mental health. If they are getting SUD or mental health funding, they would be considered JBBS clients. a gain needs to be completed. They're only receiving competency enhancement. So that's for our 10 jails that have competency enhancement funding. That is a completely separate funding stream. If they're just those folks, then we would not do the gain on those folks. I'm gonna go with we're good on that one. All right.
Thank you.
Nancy. Oh, yep. Christina, thank you. Nancy, you are next with your hand up.
Okay, so this is coming from the provider and the counselors. I don't know if they're on, but they just asked, it's on page 19, that we don't have site codes or identifiers, site code or site identifier for each of our jails. Are we supposed to have that?
Site code or site identifier. Camille, help me out. I think we could also do booking number in that one.
Yeah, for the gain, their number, use the booking number, but the site code for your site and the site identifier should auto-populate on Chestnut's end.
Oh. Okay, I'll tell them.
Let us know, Nancy, how that works out.
Yeah, I didn't know because we're a thing of 5 or 6 jails, so I didn't know if you put us just all under catchment or if each jail has a different code. Because when I went on, I went to go see how it looked to see if anybody had done one. I did that yesterday and there was nobody up, so I couldn't see anything.
Yeah, while we're talking, let me see if I can possibly figure that out, because I've got access on my end. So let me see what I can find. If you guys are under a catchment or if you're under each individual, I can look at that and I can shoot you an email to let you know. If I can't figure it out, I'll send an email to Scott and CC you, and we can figure it out from there.
Okay, so there's no separate, we have our sign-on codes. They just keep telling me on page 19, it asks for the jail identified. And I don't know we don't have those codes. Are we supposed to?
I do know that for other programs, they are auto-populated. Like each site has its own unique identifier, and each person that's logging in has its own each identifier, and it'll auto-populate on the report when you run it. I would just double check to make sure it does. Like, view again once it's done, and if it isn't, let Becky know, and then she can get in touch with Chestnut to verify.
Okay, sounds good.
And Nancy, it does look like you are all separate. I'm seeing Baca on here. I'm seeing Crowley. I'm seeing all the counties listed as separate, not all under Prowers. So it looks like you all are separate. So there should be separate codes.
Because we all have one sign-on for the catchment.
It looks like maybe when you drop down to say what county the person is in, what county you're from, then pick the correct county and you should get a code from there. If you are not, though, shoot me an email and we'll reach out to Scott.
And then one more question. Is there a way I can do a gain assessment, a fake one, so I can actually see this, how it looks online?
Yes. What I would do is I would just put it under a test, like the name test, and then just go through it and check. And then we can reach out whenever, anybody in your agency wants to test it out. I would recommend them just going on to that individual that says test, and that way nothing gets mixed up.
Thank you. That's what I'll do. Thank you.
Thanks, Camille. Cool. Thanks, Nancy. All right, Cassandra, you are next with your hand up.
All right. So are we supposed to be completing the gain on new individuals, like starting July 1 on new applicants, or are we supposed to go back and do it on all current participants?
New.
Okay.
You do not need to go back. Anybody who has a new referral, go ahead and do it on those folks. Do not go back. If you have somebody that it would be helpful, right? If you have somebody that's been there, that maybe they've got some updated information and it would be helpful to go ahead and do the gain, and you've got some time, your clinicians have some time, go ahead. But that's not a requirement. It's required on new folks.
Okay. Thank you.
Absolutely. Thank you. All right, Olivia, you are next.
Sorry, I think I'm gonna go back to a question.
You not need to be
Um,
sorry at all. Totally.
So
fine.
so I'm the mental health therapist for Pitkin Jail, and I was all set to do the gain with one of our inmates, but he had a lot of like delusional thinking and was not able to he would not have been able to like complete that assessment. So how would I guess go about that when they're like talking in like a delusional frame of mind?
Yeah, so they wouldn't meet criteria for then JBBS technically, right? Because they're
Okay.
decomposed or to actually participate in any services, and part of the point of JBBS is folks need to be able to participate in their own treatment, right? They need to request treatment. They need to be able to participate in it. So if that person is not there yet, if they need some competency, if they need some meds, whatever it ends up being, in Civicor, they wouldn't be appropriate for JBBS. So
Okay.
obviously, if you're the only therapist, right, and you're
Yeah.
still treating them, totally get it, but they wouldn't technically be able to fit for
Okay.
JBBS. So you can say no, and you can put a
Okay.
note in there as well that says person to decompensated, whatever it might be.
Okay. But I can fill it out in like my other company, like
Yes.
stuff. Okay. Sorry.
Yes,
I was just
yes.
kind of getting confused. Sorry.
No,
Thank
no,
you.
no, don't be sorry at all. No, that's absolutely fine and a great question. Well, thank you. Marilyn.
So I guess kind of going back to what Olivia said. So if I'm just kind of checking with somebody who's on like competency or whatever, I still am recording that I'm doing something in Civicor. They're just not part of the, they're just, I'm not really, I guess I'm just checking in with them as a liaison between bridges. So
Yep.
do I document that then in Civicor?
It technically would be up to you if you want to
Okay.
document them in Civicor. It might be nice to track those folks.
That's kind of what I feel like, that
Mhm.
it just demonstrates that I am doing stuff that's maybe not JBBS per se, but still a liaison or a middle person for bridges and so forth. Okay. And then
And that's okay.
what's that?
And that's okay.
Okay.
At that point, I'm going to kind of leave it up to you all
Okay.
on if you want to track them or not.
Okay. Okay. And then my next question is, people can refuse to do this assessment. Is that correct? Or do they have to do this assessment if we're going to give them services?
I actually don't know if we've discussed that.
Okay.
Camille, Alex, thoughts on that? So obviously someone has the right to refuse. I mean, obviously
Right.
someone has the right to refuse. Let me put this out there. The way I think about it, someone absolutely has a right to refuse. If somebody is requesting JBBS services, it's
Okay.
a voluntary program.
Mhm.
It's the gain is a part of it, however,
Okay.
right? And so if they want to participate, to me, they would need to participate in the gain as well. But they absolutely have a right to not participate in the gain. Camille, what you came off mute. What's your thought on that?
That was also mine. I know for our program, like in order for somebody, it is also a voluntary program, but in order for somebody to participate in it, they are required to do.
Okay.
But
Okay.
there are questions that they can refuse to answer. So, I mean, if something is triggering somebody, or if there is an actual box on the game where it does say refused,
Okay.
you can click that and it won't mess up with the algorithms that calculate the end part of the report. So,
Okay. I think I just have to do one of these reports to really understand a lot of what you're saying.
no, it's okay. And if you ever want to walk through it or anything, I can hop on, or, we can go through it together.
Yeah, I still haven't gotten the login either. So I was given this paper copy, which is really complex looking, but I'm sure I'll figure it out. Thank you.
And read it over to Marilyn and let us know. Hopefully you'll get those logins soon.
Okay.
I've got a couple of emails with folks that need logins. So I think we were kind of inundating Scott last week with logins, and a couple of his replies to folks were, we have a lot of requests, bear with us. And I'm like, well, okay, I'm still going to send you these emails. Like, I'm still going to
Right.
send you these folks need their logins. This was as of July 1st. So we really need this. So Marilyn, have we reached out to Scott about your login?
I have.
Okay.
I've reached out to somebody. I can't remember who it was, but I got the exact same reply that we were just inundated and that they're working on as quickly as possible. So
How long has it been since you reached out?
I don't know.
If it's
July.
been
Probably July 2nd.
okay, it's been a week. Let's reach out again. If you'd like me to reach out, if you could just shoot me an email,
Sure.
and I can forward it and I can reach out to Scott while I'm reaching out for everybody else as well. Because I think I've gotten looks like four other emails or so for folks that I need to reach out on. So yeah, we can reach out all at the same time since it's been about a week or so.
Okay. Okay.
Awesome. Thanks, Marilyn.
Uh-huh.
All right. Michelle.
Yeah, just add me to that list too. I reached out on Monday again to remind him that I need to log in, and he sent the same reply on Monday that I'm on the list, but they'll get to it. And he said a few days, so maybe by tomorrow I'll,
Okay.
but yeah, just if you want to add me to that email list of people that I need to log in still.
If you could then send me an email as well, that's kind of how I'm trying to work it because I don't want anybody to get lost in the shuffle. And if I have an email that's unread, I'm going to go ahead and address it, right? So yeah, if you can just shoot me a quick email, then yes, we can address it with Scott then. Thanks, Michelle. All right, Danae, and I apologize if I didn't say your name correctly, but you have your hand up next.
Perfect. No, that's exactly how you say it. We have a couple of questions for the Weld County. The first one is in the criminal history one. It asks specifically about like a DUI, selling of illicit drugs, creating of illicit drugs, and like if they've stolen property within like the past, like how long it's been. In the Weld County Jail where we're like in, they have a policy where if anyone within the counseling staff is told of any current, past, or future criminal activity, we have to disclose that to security staff. How would it be like, could they use the gains in court against them if they say like, hey, like they have a DUI charge and in the gains they said, oh yeah, within the last month I drove drunk, and they were like picked up within that month? Is that something that could incriminate them, like if they ask for that for court? Or we were just a little concerned about that.
I don't know. I'm
Okay.
gonna go with that. I don't know. So if there is a concern, and if there's this policy that you have to report any type of reported criminal behavior or anything like that, I would say you might want to skip those questions.
Okay. And then our next question is, we usually screen people into our program before we fully accept them. With the gains assessment, do you only want people who are admitted into the JBBS program to be like to have a gains performed on them? Or is it anyone that we come in contact with?
Nope, anybody that's admitted into the JBBS program. So it's going to be, if you have kind of your own type of screening that you do to make sure they're kind of where they need to be, that they are voluntary and not kind of trying to mess around or anything like that, then go ahead and do what you need to do. But once you accept them, then I would say it needs to be completed within that what do we have in the contract? 14, 15 days in the contract.
Okay. Yeah, and we would do that. Awesome. Thank you so much.
Yep, absolutely. Thank you. All right, Erin.
Okay.
Hi. So quick question. Do all of the questions have to have some sort of answer for the algorithm to give a correct calculation? Because quite honestly, there's a lot of questions that we wouldn't be using from this in our facility.
So I'm going to let Camille, and sorry, I see my screen kind of freezing occasionally. I apologize about that. I'm going to let Camille handle the algorithm and the what ifs. But I also would say try to answer whatever you can, even though it's something that you wouldn't do in the past. This is information, this is data about our clients, about our JBBS clients that we are trying to get statewide. So this is, we are going to compare all of the clients across counties at the end of the year, where it'll help us run our reports. It'll help us kind of see who we're treating, who's getting better, who's not getting better, that type of thing. So I would say, even though it's not something you would normally answer, if there are concerns about, that Danae just brought up about possible charges or anything like that, I totally understand skipping some stuff, but try your best to answer all those questions. And then now I'll pass it on to Camille and let her answer kind of the algorithm stuff.
So it is my understanding that the majority of the questions, if there is not an answer in it, they will not calculate correctly at the very end with the summaries that you're able to print and pull. And so even like when it's scoring the moderate, severe, or low risk factors for like high risk behaviors or substance use, it won't calculate that if there's too many missing. So it'll just kind of skip that. So Becky's right, as many as you possibly can answer.
Okay, can I just voice what our concern with some of the questions are? So we aren't going to ask a sex offender about their sexual history, or someone who's a child predator, you know, what their sexual history is, because that's just obviously not where we want to go. There's also quite a few that go really super in depth with their military that are, you know, I can see how that would be useful, but long term, but I'm not sure. And then there were a few as far as like their schooling, like when was the last time you were late to school? But since obviously inmates are adults, we wouldn't be asking those questions. So I mean, taking that into consideration, the schooling and the sexual history type questions, if we didn't answer that, what would your best guess be that our algorithms would be somewhat accurate?
I do agree with you as far as like the sexual questions, because that was something that I think that it could, yeah, that's definitely something you wouldn't want to do on a sex offender. So for the school one, I think even if you were to skip past that portion, I don't believe that would mess anything up. I think that's just in there for individuals that have been in school, so I wouldn't stress that. The sexual one, I wouldn't even ask it. Just like you had mentioned, I would not bring that up. What I would do is I would just put don't know. So when you do go into the GAIN, the electronic GAIN, there is at the end of each question, it says DK or RF for refuse. So I would just hit don't know and just leave it at that. I definitely wouldn't put yourself in a position where you're asking those on a sex offender. So just put don't know and it'll skip it for you.
Okay, perfect. Thank you so much.
Yeah, no worries. And I was going to say too, I mean, sometimes I know that some of the questions, they do feel like they could be triggering also, like when you start asking the questions about like a victim of abuse. Like basically we do want to track if somebody was a victim of abuse, but sometimes the way that some of the questions can be worded, that could be a triggering. I mean, you don't have to ask it verbatim. You could actually change some of the language to where you feel comfortable and you know they would feel comfortable. I mean, it's not, you know what I mean, something that you want to cause more harm by asking either.
Yeah, and I wanted to reiterate that too. You all in the jail too are not sex offender therapists. You are not, that's not your role here. So if you do have a sex offender, then I would skip those. I would skip those questions as well. Right? Do not know. And obviously we need to remember our settings. And our setting is jail, and there are a lot of questions that may come up that might be triggering for folks. And if we think that might be triggering, if we can reword those questions, that would be best case. If we're thinking we can't reword those questions and it's just best to not ask, that would be fine as well. Where it's kind of in do your best. This is a jail setting and we all understand that it's a jail setting. So do your best to really do as much as you can, but we all understand that there are some things that won't be appropriate in that setting. Cool. Thanks, Aaron. Good questions. RH, you are next.
Okay, so my question was, if you have a client that wants to do the physical copy and do it on their own, because they do give that option at the bottom of self answering, is there one that has the narrative of the person who's doing it? Because right now it's basically narrated for the clinician and not for the client.
Camille,
I
do
have
you-
not seen one. Sorry. Yeah, I have not seen one that is in that situation, that setting. I do agree with you. Usually for anybody that is in my program, what I would do is I would take off the top sheet. I mean, there's no reason to continue to, you know what I mean? Like having to explain it. The first 2 pages are pretty much for the person that's asking. And so I do agree with you, I think, but I usually just take those off and I hand it to them and just ask them to fill it out to the best of their ability, just because there isn't one that I have seen. And I do apologize because sometimes that is hard. But I mean, if they're willing to do it on their own, I think that's a pretty good thing too. If they have any questions, they can just reach out to you and ask.
That sounds good. Thanks, Camille.
Cool. Thank you. Did you have another question or are we good with that one?
We're good.
Okay. Thank you so much. Cassandra, you're up.
So for the scoring, and maybe just because I haven't done it, if you are giving the paper copy, you have to enter it into the computer system to generate a score. You cannot score the hard copy.
Yeah, that is correct. You'll have to take the paper copy and enter it into the computer to actually get the information. And that's the only way that we can actually extract it too, because we wouldn't ask you to save the paper copy anyway. So then it's, not clogging up your systems in your office also.
Okay, thank you.
Yeah, so Cassandra, if you can, when you get those paper copies entered, so once you get them entered into the system, you can do what you need to do with those paper copies. They've already been entered. We can track them then. You can go back and track them. So you don't necessarily need to keep those at all. You can go ahead and shred those since they are in our system at that point.
Okay. And then just, I guess, to clarify, we're still doing this and then entering information into Civicor, correct?
Yes. However, we have updated Civicor a bit. So there are fewer questions now we are asking in Civicor because a lot of this, so a lot of the background, a lot of the demographic information is being asked in the GAIN. So we are no longer asking those questions in Civicor. So hopefully your Civicor stuff will be a lighter load because you are then having to do the GAIN on these folks.
Okay. Thank you.
Yep. And on that note, you all will see some, if you haven't already, you'll see some changes in Civicor. You'll see the demographic information is a lot shorter. Most of that stuff is not in there. Some questions you need to answer before the boxes expand. The discharge questions have changed a little bit. So some things have changed. So just keep that in mind. And that's stuff that we can go over in our quarterly meeting next week as well. So just keep that in mind. I know this is GAIN and we want to keep it GAIN, but just keep that in mind for Civicor. And if you've got those questions, bring them to the July 18th meeting. All right. Thanks, Cassandra. Ruby, you are up.
Hi, I just had a question along some of the changes within Civicor. I've seen that there's now a requirement for the admission date, but it asks if there's been JBBS participation. So it's kind of tough when we get a referral, but this person declines JBBS participation because the admission date is now required. So that person is then listed as admitted.
That's a good point. Alex, do you have thoughts on that? Alex and has been working with us on the Civicor data. Do you have thoughts on that? Do we maybe need to change that?
Yeah, I'm taking a look at it now. That's something that we would need to change for sure.
Yeah. So Ruby, thank you.
The idea is we need them to be recorded that, that they were considered and that they declined, right? So we'll take out the requirement for that admitted date.
Great. Thank you.
Ruby, thank you for that. That's the type of stuff we want to know, that we're trying to kind of fine tune, but we can make changes pretty quickly to Civicor. So that's the type of stuff that if you let us know, we can usually make a change pretty quick. So
Perfect.
Thank you. And thanks, Alex, for looking at that. I appreciate that. Cool. Well, that's all the hands, but I'm gonna leave the floor open right now, see what other questions we might have. Any feedback yet on the GAIN? No feedback. I'm seeing a lot in here. I logged in just a minute ago to look at Nancy's, when Nancy was asking questions. We've got got quite a few assessments in there. So I appreciate that. You all we're only at the 10th day of the fiscal year and you all are rocking it. So I appreciate that. Well, what are thoughts of, we're about 30 minutes in. We're leaving it open an hour just in case folks need it. But if we've answered all the questions, if folks aren't needing the whole hour, we can go ahead and wrap up. Oh, we got Bobby. Bobby has a question. Bob,
Sorry, I didn't know if it was going to allow me.
That's all right.
Where it says in JBBS or in Civicor, sorry, where it says, did they receive JBBS services at a previous location? Is it possible to get an unknown? Because I keep getting, I don't know what services I got, things of that manner. It wasn't a yes or no.
Bobby, I think that's a really good point. Alex, is that something that you think we could add?
Could you repeat the question? I was emailing John to change the admission date.
Sorry, Alex.
It's okay. What was the
So yeah, Bobby's wondering about in the section that says, did the client participate in JBBS services at another facility? Instead of yes and no, could we have a yes, no, and unknown, or client does not know, or something like that? Unknown would probably be best, right, Bobby?
Yeah.
We can add unknown. I mean, for now, just put no. Like, it's basically, if you can't confirm that they have, then just put no.
And that's what we have been. We just wanted to make sure that we were doing it right.
Yeah, you're good. Thank you.
Yeah, let's work on adding an unknown, but yeah, no for now would be fine. Thanks, Bobby. Cool. What else? All right, I've got a couple emails. Looks like one, two. Oh, Nancy, go ahead.
I forgot. I'm getting text messages. Is everybody experiencing a lengthy time it takes for the game right now? Because ours are. They're just.
Alex, yes. How long is it taking you, Nancy?
Well, me, I haven't done
Well,
one.
How long is it taking your folks?
About 2 hours.
Ooh.
Now I realize one of them, she won't do the computer at the same time with their, because there is issues of bringing a computer into the jails a lot of times. So then they do paper and then they have to go home and put it in. Does that process get quicker? I'm hoping.
So I can tell you, I've never heard of anybody it taking 2 hours, but I would.
One of our counselors.
I know, but it's new.
Smart.
That's what I was just going to say. No, it's okay. It's a new process, right? Like we all learn and different people have, it does get much quicker. But if there's ever a time that she even wants to go through it, like we can do a mock gain and kind of see like if there's a way to do it, or if maybe, kind of help with the process. I think if you were to read everything verbatim, it would probably take an extended amount of time, and you'll kind of get used to it as you go through, so you don't necessarily have to do that. So, okay. I mean, but if she wants to meet with me, I'd be more than happy to like have her test it out on me, and then maybe we can kind of go back and forth and get, some time down to see if we can shorten that for you guys, so it's not such a long process.
Yes, because it's pretty lengthy for some. And even Dee, she's our provider, she says, oh my God. But one of the people said if they're on a flight of ideas or just rambling, she couldn't get through it, so she stopped it. So she'll know, then she won't even have to do those gains. And that's just mental health only, but they're still a JBBS client. Thank you.
Yeah, and I want to make that known that if the person is too decompensated to do it, then they are essentially too decompensated for JBBS, right? And so we need to remember that, that's the point of the gain. It's kind of seeing how those folks are doing. If they're able to get through it, great. If they're not able to get through it, they may not be appropriate for it right now. Maybe after some meds, after some therapy, that they'd be great. But right now, it's probably not appropriate, and they may need some different services in order to get them to that level that they would be appropriate for it now.
Okay, thank you.
Thanks, Nancy. Pueblo JBBS, what you got?
One more question. So like when it says like what kind of diplomas, degrees, work related certificates, like that question, and then it has like one, like all the answers, and you can either answer yes for one or 0 no. So let's say if they only have their high school diploma, so you circle 1 for yes, and then the rest are all no's. When you enter the assessment in the system, do we have to put zeros for all of those, or can we just leave them blank?
I believe that you can just leave those blank. I don't think that you'd have to go through and click all of them. At that point, the yes would just be the positive that we would extract. So
the only reason I'm asking is because I did leave them blank, but then when you pull up the full report, it shows missing, 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 missing. So I just
yeah,
wanted to make
and
sure.
it will
Okay.
show that. But those ones, like those kind of questions that are like height, weight, education, anything like that, if there's a yes, a positive in there, we would just assume that the rest were negative. So it would those would be okay, I think.
Cool. Awesome. Thanks, Camille.
I actually, I'm going to contradict that. I do think that you should, if in the gain, it says which of these have you received, right? So somebody, because some of them in here, vocational trade certificate, trade license apprenticeship, somebody could have a high school diploma and a vocational trade certificate and a trade license apprenticeship. So that'd be 3 ones, right? So, you know, I would say, you know, whatever they have needs to be a 1 and whatever they don't have needs to be a 0. Because then it's tracking that in the system. Because somebody could have multiple yeses on this. It's not just what's the highest level that you've achieved. The question is literally what kinds of diplomas, degrees, work-related certificates, or licenses have you received? Not what's the highest level of education that you have, right? It's what kinds of diplomas and degrees. So I do think that having that 0 in there is going to do a better job tracking that information across multiple entries.
So how about this for now? Let's go ahead, if you guys can, let's go ahead and just for all the no's, do a 0, and we will continue discussing on our end. Let's see what things come back. Let's see how cumbersome it is. If it's super cumbersome, let's come back to our next gain office hours and let us know. Give us that feedback, and then we can tweak if we need to.
If I can just jump in, when we did one, if you do it on the computer, it automatically goes to no, and then you click yes. So if you do it on the computer, it automatically puts those all as no, and then you click yes for whichever one they have. I don't obviously think that is for the paper copy, but for the electronic copy, it automatically codes that for you.
Yeah, Danae, I think that's really helpful that if it's automatically coding it, and then if you had 3 yeses, you could then go back and change it to yeses. I think that's helpful. So if folks are doing the paper copy right now because you don't have your login, I totally understand. But hopefully then once you've got your login and once you can get in on the computer, hopefully it's easier for folks. So thank you, Danae, for that feedback. Whoever's asking at Pueblo, is that sufficient for now?
Yes, thank you.
Okay, thank you. And thanks for that, Alex. We don't always agree, but we make it work. And again, bring us feedback. We're going to schedule another office hours probably in another month. If folks are really, 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 really needing it, there's a lot of questions. We may schedule it earlier, but another month or so is more than likely. And then we can bring that feedback back and we can see how we're doing with stuff. What other questions, feedback? It looks like I've got 1, 2, 3, 4, 7-ish folks that are maybe needing some logins or at least have an issue. It looks like mainly logins is what folks are needing. So I've got about 7 emails right now. If you sent me an email, just give me a little bit of time to go through them. I will be going through those right after this meeting. So hopefully it won't take too long, but I'll be going through those and CCing Scott to hopefully get you those logins or at least get a reply from Scott. If a week from now you don't have, and I'm going to CC you all on the email, whoever sent it. If you don't have a reply from Scott fairly soon, let me know and we'll reach back out. If you don't have your login within another week or so, reach back out to me. I will be on vacation the 22nd through the 2nd, but I will be around next week. Camille, Alex, and Kelly will all be around while I am gone as well. So if it's something with the gain between the 22nd and the 2nd, I am not around, but Camille, Alex, and Kelly are. So you can for sure reach out to them. I will also have an out of office. So if anybody emails me that's not on this call, or if you forget, I'll have an out of office. So you can reach out to Kelly then at that point. But what other questions, feedback do folks have?
Hey, Rebecca, this is Galen with El Paso County. Can you hear me?
Oh, Galen, I kind of heard you. You're really, really quiet.
I'll try again. Can you hear me yet?
Yes, that's way better.
Okay, all I wanted to say was this. We are doing most of our gains with paper and pen with the clients in the jail. And then we come back and we enter it in, to the website, right? That's our process. One thing that I've noticed, and I don't know if anybody else has, is it feels a little wonky to me in the website in terms of how the questions lay out and going through it. It just seems to be a bit cumbersome and kind of not, I don't even know how to explain it. It's a little more time consuming, it feels like, when we're entering it in, and it just goes slow. That's all I can say. It just feels like something that should be 2 or 3 minutes is actually 10 minutes. And that's the only feedback I would say.
Yeah, so when we meet with Scott next, I'll bring that up with him and we'll see if there's a way to kind of streamline that in the system. There may not be, it may just be that's kind of what their system does, but I'll bring those comments because we don't control how they've set it up in the system, right? But we can work with them to try and make it easier to, we'll let them know, hey, a lot of people are taking paper copies and they're entering them in later, and that process is very cumbersome and time consuming. So what can we do to reduce the amount of time people are spending on that? And that might be why Nancy was talking about how it's taking 2 hours because they're doing paper, and then when they go to enter, it takes a lot longer. The other thing that I can say about this is somebody who's done a lot of online forms, at a certain point you get used to it and you start to just get faster at it, right? And at the beginning, it's always going to take a little bit longer, but that's not really a satisfying explanation at all. So again, when we talk with, this is something we'll bring up with him and we'll say, can we make this a simpler process, and make it clearer and better laid out for sure.
Awesome. Thanks, Alex. Yeah, I just think I don't know if anybody else is dealing with it, but it just feels like the questions, when you hit enter, it just takes a little more time for it to go to the next thing, to the next thing, to the next thing kind of thing. So, yeah.
I don't know if it's very much faster, but there are 2 options when you're entering it. It can say begin interview or data entry. And sometimes it feels a little bit faster if you do the data entry, if you're entering the paper copy. I don't know if that will help you in that situation, but.
No, thank you. I didn't even know there was an option like that.
Yeah, at the very beginning, after you enter somebody's information, and then you go to the first tab where it says to create and it's not an event. I can't think of what the word is, but where
It's
you
an
create
episode.
Yeah, you create an episode, and then you click on that, and then it'll ask you which gain you're using. You click on that, and then it'll say at the very top, begin interview or data entry. And if you click on data entry, sometimes it feels like it goes a little bit faster, but I don't know if that will help at all.
No, seriously, I have never noticed that. So I'll the next time I enter, I'll look to see if I can see that.
Okay.
Thanks.
Thanks for the feedback, Galen. And it sounds like Marilyn is seeing the same thing. Sounds like others are kind of, with Nancy too, others are seeing the same thing. So hopefully it will get faster. Hopefully that data entry piece will help. Hopefully we can talk with Scott. This is all stuff that we can hopefully tackle. There may also be a lag, and this is just brainstorming. There may be a lag because of so many people going in, having to get user access right now. Chestnut's kind of bogged down, having to get a ton of user access and login codes and all that stuff. So I'm thinking maybe the system might be bogged down right now, but as folks get their logins, hopefully that'll clear the system up a little bit. It'll clear it up on Chestnut's end, and hopefully things will speed up. So that's kind of my hope at this point, that the system itself will clear a little bit once Chestnut isn't in kind of doing things on their end quite as much. Fingers crossed on that one, but all right. What other questions, feedback do we have? All right, we're at 1:45. I'm gonna say going once.
So I know we're not supposed to talk too much about Civic Core, but I've had a couple of questions about the same thing in Civic Core. So could I show something about that real quick? And maybe people haven't gotten to this point. So I'm going to share my screen just real quick. Okay. And hopefully everybody can see this. So this is under when you start a new referral. And I just emailed to add the new category for where you enrolled in another facility, to add unknown, and then to remove the requirement for admission date. But people are, there's been a couple of questions. Well, you know, I'm not seeing the discharge information. So when you click, was client discharged from JBBS services? If you click no, nothing happens. But if you click yes, a new box pops up right here called discharge. And then if you put in the services discharge date, right, let's say today, and then discharge type, if you say unsuccessful, then another, it's auto-populating based on how we're answering previous questions. So if you say no here, that box goes away. But if you say, was client discharged from JBBS services? Yes, you'll get a new box that has the discharge information there. And it's kind of confusing because it doesn't populate right underneath that question. It populates in its own little box right here. So I've had a couple of questions about that. And that's separate from this question about was client released from jail, right? So you could have, were they discharged from JBBS services? No, but they were released from jail, or vice versa. So I just wanted to point that out for everybody right now and answer any questions about that.
Alex, looks like we have a question from Pueblo. So Pueblo, go ahead.
So to kind of piggyback off of that, our question was about the wording of that, like how it says was client discharged from JBBS services. That is then separate from client released from jail, right? Or is that essentially the same thing?
Most of the time it's going to be the same thing, but there are going to be those few examples where somebody misbehaves and is discharged from JBBS services, right? So they've been discharged from JBBS services, but they haven't been released from jail, right? So we wanted to separate those. That's a rare occurrence, but we wanted to kind of incorporate that in the questions. So most of the time it's going to be the same, but there are a few instances where it's not, and we wanted to be able to capture that in the data.
Okay, because that's where we were really confused about that, because we thought essentially client being released from jail would be what initiated the discharge date and type, instead of the client being discharged from services.
Right. But again, there's those few examples where somebody misbehaves and is discharged from JBBS services, but they're not released from the jail. Does that make sense?
Kind of.
Okay.
Yeah, so in some facilities, facilities all work different, right? So every jail has their own JBBS program. Every JBBS program runs differently. In some facilities, there is a specific pod for JBBS participants. If they are not engaging, if they are misbehaving, if they are not following jail rules, they may be kicked out of the JBBS program. They are still in the jail. They are no longer in JBBS. They are discharged from JBBS. So that doesn't happen often. That doesn't happen too much. There aren't a ton of facilities that operate that way, but there are some. So we need to make sure we cover all of our bases. So for those particular instances, for those particular clients where discharge from JBBS is not the same as released from jail, we want to capture those. So that's why we have that.
That makes sense, but I think that's you guys are still kind of missing what I'm trying to say here, because we're saying that, like, was client discharged from JBBS services? That's what gets the tracking date to initiate. So in our minds, being discharged from JBBS means you're no longer in the program, you're no longer with us. So that in our minds wouldn't create a service discharge date. Do you see what I mean?
Yeah, so can you say, was client discharged from JBBS services? No, and then yes, client was released from jail?
You can do that, but it won't initiate the discharge date.
Okay.
Got it. Okay.
And I guess that's my question, because then there's if they haven't been discharged from JBBS services, then why would we record a discharge date?
Because they're released from jail.
Yeah, because they're released from jail, Alex. I see what they're saying. They still consider them a part of JBBS. So they still consider them a part of JBBS, but they are now released from jail. So they are a JBBS participant that is now in the community.
Okay.
Right.
So you need that for the tracking purposes.
Yes.
Okay, that makes sense. Yeah. So we'll see if we can add a field for that to get the date in there for the release.
Yeah, so
Okay.
sorry guys, we were We were misunderstanding, so sorry about that. But yeah, let's see if we can get a section added for that.
Okay, thank you.
Yep, thank you. Well, thanks, Alex. All right. What else we got? I think this has been really great. I appreciate everybody's questions. I appreciate everybody's participation. This has been really awesome. I think I was just chatting a little bit on the side with Alex and Camille, and we're looking at possibly scheduling another session, I think August 7th or so. That would be 4 weeks from today at, I think 2 p.m. versus 1 p.m. because we've got a 2 p.m. meeting. So that's kind of tentative. If you'd like, please put that in your calendars for now as a hold, as a tentative date. But let's kind of, like I said, tentatively plan on that. But I will leave it open one more time for questions or feedback.
Can you repeat that date again? Becky?
Yes, August 7th, Wednesday, August 7th at 2 p.m. is kind of our thoughts right now. Thanks, Marilyn. All right, I'm going to leave it open one more time. Going once. Going twice. All right, we're going to go ahead and call it. I appreciate everybody. Appreciate your feedback. When we have another one of these, please let us know how things are going. If there are questions in the meantime, you do not have to hold on to your questions until August 7th. You can reach out to one or all of us if you'd like. If there's any feedback, especially anything not working, we want to know immediately if something's not working. If there's a weird question that's not populating in the system, let us know. Just those are examples. Just let us know. That way we can handle it right away versus waiting for our next meeting. So yes, thank you everybody for your time. Appreciate you, and we'll let everybody go. Thank you. Everybody take care. Have a great rest of your week. Bye-bye.